Hello, and thank you for the opportunity to present today. My name is Kimberly Stetson, and I am a program coordinator in performance management and an MPH student at the University of Arizona Global Campus. Today's presentation will provide an overview of a community health assessment conducted in Everett, Washington, using the CDC's Change Framework. I will walk through the purpose, methods, key findings, and proposed action plans to address priority health needs. This presentation will begin with an overview of the purpose and methodology of the community health assessment. I will then briefly introduce the change framework and describe how it was used to evaluate community conditions across 5 sectors. Next, I will summarize the most significant findings, including strengths and priority areas for improvement. Finally, I will present 2 targeted action plans addressing the most pressing health concerns identified in Everett, followed by recommended next steps for implementation. Community health assessments are essential tools used to identify health needs, disparities, and priority areas within a population. One key benefit is they help identify health inequities, allowing interventions to be targeted toward the populations most at risk. The change framework supports a structured, data-driven approach with an emphasis on social determinants of health, such as housing and access to care. This assessment was conducted as part of my MPH capstone project and focuses on Everett, Washington. The goal was to identify community strengths, gaps, and priority health concerns in order to inform evidence-based public health action. It is also important to distinguish between assessment and evaluation. Assessments focus on identifying community needs and assessments, while evaluation examines the effectiveness of interventions once they are implemented. The change framework is designed to assess current community health status by examining policies, systems, and environmental conditions that influence health outcomes. Rather than focus solely on individual behavior, this approach evaluates how broader structural conditions contribute to health disparities. This allows organizations to help identify both strengths and gaps within the community and develop more effective, sustainable interventions. A key strength of change framework is its ability to frame and clearly describe the current status of community health across multiple sectors. One of the key benefits of change framework is its emphasis on policy and environmental change strategies. It provides evidence-based guidance that aligns interventions with identified community needs. In addition, it encourages collaboration among stakeholders, which is essential for implementing sustainable public health improvements. These strategies are particularly valuable because they focus on long-term, system-level improvements rather than short-term behavior change. This assessment evaluated 5 sectors: community at large, community organizations, healthcare, schools, and work sites, each of which play a unique role in shaping population health outcomes. A multi-method approach was used to collect data, including observation, secondary data analysis, and survey-based insights. Combining methods improves the validity and reliability of assessment findings. Due to the rapid timeframe of this assessment, credible secondary sources such as CDC, U.S. Census Bureau, and Data USA were used to ensure accuracy and feasibility. These sources were selected because they provided reliable, population-level data that is appropriate for community health assessment. The change framework emphasizes collaboration across multiple sectors to improve public health outcomes. Although this assessment was conducted independently, key stakeholders were identified to reflect a real-world team approach. These include public health professionals, healthcare systems, community organizations, and government agencies. Each play an important role in providing expertise, supporting implementation, and ensuring alignment with policy and community needs. This stakeholder-driven approach is essential for sustainable and effective interventions. A mixed method approach was used to collect data, including environmental observation, secondary data analysis, and qualitative and survey-based information. This approach improves the validity and reliability of findings. In addition, a visual photo voice style approach was used to document community conditions, highlighting both strengths, such as parks and services, and areas for improvement, including housing challenges. A key strength of this approach was the use of multi-data sources. However, limitations included reliance on secondary data and limited primary data collection due to time restraints. One limitation of this approach was the reliance on secondary data, which may not fully capture the recent or localized changes. After collecting data from multiple sources, findings were analyzed across the 5 sectors of the change framework: community at large, community organizations, healthcare, schools, and work sites. In the community at large sector, housing affordability emerged as a significant concern, with many residents experiencing cost burden. Community organizations provide valuable support services. However, there are limitations in the behavioral health program capacity. In the healthcare sector, while access to hospitals and primary care is a strength, there is a clear shortage of behavioral health providers. Schools offer strong educational resources, but there are gaps in school-based mental health support. In work sites, employment opportunities are present, but workplace mental health and wellness supports are limited. Across all 5 sectors, the most consistent challenges identified were housing instability and access to behavioral health services, which informed the priority areas for intervention. To interpret these findings, lower scores within the change framework indicate gaps in policies, systems, and services, while higher scores reflect stronger infrastructure and support systems. This scoring helps prioritize areas of greatest need and guide the development of targeted actions. This assessment identified several strengths within the community, including strong healthcare infrastructure, access to education, and established community resources. However, 2 major areas emerged: affordable housing instability and limited access to behavioral health services. Census data indicate that a significant portion of the population lives in poverty or experiences financial strain, which contributes to housing instability. Housing is a critical social determinant of health, directly impacting both physical and mental health outcomes. This slide provides a visual representation of the community conditions identified during the assessment. These images highlight both strengths, such as access to parks and healthcare facilities, and the area's improvement, particularly housing instability. These visual observations complement the quantitative findings and support a more comprehensive understanding of environmental influences on health outcomes. Together, these images provide a clear visual evidence of both community strengths and the significant priority issue identified in the assessment. The first action plan focuses on improving housing stability with the goal of increasing access to affordable and stable housing for low-income populations. Housing is a critical social determinant of health, and instability can negatively impact access to healthcare, employment, and overall well-being. Strategies such as expanding affordable housing, increasing rental assistance, and implementing housing first models directly address these challenges and target the most affected populations. This plan emphasizes system-level interventions that address housing as a core social determinant of health. The second action plan focuses on increasing access to behavioral health services, particularly for underserved populations. Improving access to care is essential for addressing mental health needs and reducing disparities, especially given the high prevalence of mental health conditions nationally. Barriers, such as provider shortages, further limit access to care, particularly in underserved communities. Strategies such as telehealth expansion and integration into primary care can help address these gaps and improve access. National data show that approximately 1 in 5 adults experience mental illness each year. Let me repeat that stat for you. National data show that approximately 1 in 5 adults experience mental illness each year, highlighting the importance of accessible and equitable behavioral health services. These strategies aim to reduce access barriers and improve continuity of care across systems. These next steps are critical to moving from assessment to implementation and ensuring long-term sustainability. Key next steps include engaging stakeholders, prioritizing interventions, and developing implementation plans based on the identified action strategies. Ongoing evaluation is also essential to ensure that interventions are effective and sustainable over time. In conclusion, this assessment highlights both the strengths of the Everett community and the need to address housing stability and behavioral health access as priority health concerns. By implementing targeted evidence-based strategies and strengthening community partnerships, there is a strong opportunity to improve health outcomes and reduce disparities across the population. Thank you for your time, and I welcome any of your questions.